Well, this week is National Infertility Awareness Week. And here in Long Island, the Gianna Center for Women's Health and Fertility offers a more natural approach to treating infertility. Joining us now via Skype is the medical director of the center, Dr. Paul Carpentier. Thanks for joining us.
Hey, Colleen. Thank you very much. Glad to be here.
I'm so glad you're here. First of all, tell us, how common is infertility?
Well, sadly, it's about 1 out of 6, 1 out of 7 couples. And one of the things that people don't realize is that after age 28, a woman's fertility starts to decline, such that in the 30s, when the woman is in her 30s, it's about 1 out of 3 women who can't achieve a pregnancy.
Wow. The reasons for infertility, they're different for different couples, different men, different women?
Oh, absolutely. Both men and women, of course, contribute to the infertility process, and our evaluation needs to focus on both of them. There are basically 70 or 80 different causes of infertility, and a restorative reproductive medicine physician like myself is going to look for all of those different causes, and in this individual couple, what is the reason? And I should say reasons. We usually find on average 4.5 reasons per couple that they can't achieve a pregnancy. And then our work becomes restoring those issues, restoring the underlying processes that are leading to their infertility.
A couple comes to you. How long could it take to diagnose the reasons?
Well, the diagnosis would happen within 2 months. And then we are already, even before we have the final diagnosis, we're embarking on helping her and his body to be more healthy. Such that most of our couples will achieve within 6 months of starting here at the Gianna Center.
How are you helping? What are the treatments?
So it's very individualized. It depends on the reason within the woman, within the man. For instance, if sperm morphology is low, then we would be working with antioxidants for his body. If sperm motility is low, we're working with other things that help the sperm motility. In the woman's body, we're identifying what is the underlying process. Sometimes it's endometriosis, and that would usually lead towards surgery to remove the endometriosis. If it's polycystic ovary, we need to help her insulin resistance. There's so many different things. If there's limited cervical mucus, then she's unable to filter the abnormal sperm away from the fallopian tube. And the cervical mucus is so critical, and most of the reproductive centers on Long Island are not paying attention to that at all.
And when I say these are all natural ways that you are doing this, it does not involve like in vitro.
Right. In vitro fertilization and what they call assisted reproductive technologies is basically bypassing the problems in the woman's body, creating embryos out in the petri dish with her husband's sperm or whoever sperm she chose, and then they're hoping for like 12 embryos in the petri dish, analyzing which of those embryos might be growing the best, and then offering her which ones she should choose to survive, in other words, to put back into her body. But in the process, since they didn't fix what's wrong with the body, those embryos are not as likely to succeed. Even their own IVF studies have shown that it's better to remove endometriosis, for instance. Furthermore, if I may, the things that lead to infertility also lead to problems during her pregnancy, such as premature birth and miscarriage.
So the success rates by going to the Gianna Center's success rates are what?
So 44% of our couples achieve just within the first year of trying. We, in general, internationally, they don't consider it a failure unless it's 2 years of trying. But I like to talk about 1 year. If you give us 1 year, 44% of the people will have a live birth, not just a pregnancy that might end in miscarriage, a live birth. So that's pretty exciting. And in fact, if I may, a study just came out in 2017 saying that if you go to what they called a generalist, meaning a restorative reproductive medicine person, versus a subspecialist, meaning an IVF center, at the end of 2 years, the success rate was the same in a live birth. It was 55%, whether you went either direction. But in the process, there were 50% less IVF rounds and, of course, less lost embryos in the process.
Do you think not enough couples know about this restorative?
Well, it's hard to market it because you just pay the minimal amount by the insurance companies, whereas the IVF centers, it's $19,000 per cycle. And in fact, there's a fellow in the UK who was one of the pioneers of IVF, and he's blasting the IVF industry. His name is Lord Robert Winston, and he's saying you're just preying on people's despair, his words. And so we're like trying to help the couple to be healthy together. And the marriage is so important. You don't want the fellow to feel like just a sperm donor. He's the husband, and we need to strengthen that marriage.
You just talked about the amount of money. This is less expensive?
Much less expensive. Most of the insurance companies love what we do. In fact, many of our referrals are now coming from the insurance companies because they see that the women are becoming healthier. There's so many underlying problems, and she feels it. She doesn't know how to explain it, but she feels it. It might be bleeding problems. It might be fatigue issues, and we get to the bottom of those. And the insurance companies are appreciating the fact that they are becoming healthier, less babies in the NICU born prematurely, less need for hysterectomies for the woman down the road. It's really exciting stuff.
Do you get inquiries from patients around the country?
Yes, we do. But there are doctors like me around the country. I was the first family doctor in the world trained in what's called NAPRO technology. That's at the St. Paul VI Institute for the Study of Human Reproduction in Omaha. So they are one of the featured referral centers, and then they train us, and we're scattered around the United States.
Here on the island, the Gianna Center, the locations are where?
Catholic Health has now incorporated and evolved 3 centers, one in New York City in Manhattan, one in Rockville Center, which is Nassau County, and one here in Babylon. So we've got the island pretty much covered.
That's right, from west to east. Thank you so much for all your information today, Dr. Carpentier.
Okay, you're very welcome. God bless.